A review of mental health services in New Zealand has found they're under pressure, under-resourced and not widely understood. The People's Mental Health Review was an action station response to funding cuts announced last year to mental health services across the country. Crowd-funded and crowd-sourced, its intention was to hear from users and practitioners about what they want and what they need. Released this afternoon, it's already received support from Labour Party leader Andrew Little, who says its key recommendations must be listened to. Now, they include an urgent funding increase, an independent inquiry and independent oversight. Professor Max Abbott wrote the foreword to the report. With decades of experience, he's head of AUT's Faculty of Health and Environmental Sciences and co-director of the National Institute for Public Health and Mental Health Research. His foreword commends the report and says it collates direct accounts of the lives and experiences of a wide spectrum of New Zealanders.
It's 500 stories from people throughout the country, sort of all walks of life, really. Most of them were people who have directly had access to mental health services or have tried to get access and not been able to. But it's also professionals, mental health workers in the services, as well as family members, both of service users and also of mental health workers. And the vast majority of them, well over 90%, pointed to shortcomings and deficiencies. A number of the remainder mentioned positive things. Probably the way this was set up, you were more likely to elicit responses from people who are concerned, and it's important to put it in perspective because many people do access services and many people find them satisfactory and benefit from them. Having said that, this does point to a number of deep-seated concerns, and frankly they're concerns of long standing. I mean, things like the difficulty accessing appropriate and timely services. You often have to wait for weeks, or you have to create or wait until something reaches a crisis before you will get a response. A number of people were concerned about an over-reliance on medication and a lack of access to psychological therapies, peer support and other resources. A number of people were concerned about stress in the mental health professionals and the lack of resourcing. There was also some concerns about an over-reliance on compulsion and violation of human and patients' rights in some cases. And a number of people also commented about wider social conditions. Discrimination.
That under-resourcing, sorry to interrupt, but that under-resourcing is so important, isn't it? And there's a very real sense that I'm getting from reading it at high speed that that's a double whammy, that people providing the services are taxed by under-resourcing because there's not enough of them to provide the services they would like to provide, and people who need the services, as you say, they're not getting the help they need as quickly as they need it or as intensively as they need it. Is under-resourcing the most serious issue facing mental health services in New Zealand? Well,
I mean, I wasn't involved directly with the report. I was, asked if I would, speak at the launch and introduce it, and I was happy to do that and to put it into a wider context because, I've been involved with mental health issues in this country and globally for God knows, many decades, and so I was happy to do that. And I share the concern of the people that contributed, that told their stories, and the people who compiled them. I share their view that we do indeed. It is time to have an independent inquiry to take stock, acknowledge the good things, identify the gaps, and chart a way forward. And there is concern that the demise of the Mental Health Commission actually removed that independent oversight, and it hasn't really been replaced. And so there is a concern about under-resourcing. It's a difficult one. How long is a piece of string? But having said that, we have a situation here where senior ministry officials are pointing to extreme strain, increase in demand. They rarely do that. And so I think that's significant. We need to take note of it. Of course, there are lots of good initiatives. There are heaps of things I could point to that are very positive. But at the end of the day, the acute services seem to be severely stretched. There is an overuse, I think, of medications and lack of access to psychological and social therapies and supports. There's a disconnect between primary and secondary care in the mental health area. People with anxiety, depression, substance misuse, disuse frankly, many of them are missing out on the help they need through primary care unless they can actually pay for it privately. And then also another disconnect between primary and secondary care. People with the more severe mental disorders, the psychoses, their life expectancy is more than 2 decades less than that of others, matched on age and gender and social situations. So, and that's oftentimes a response to other physical health issues that aren't dealt with properly, obesity and diabetes and cardiac issues and what have you. So, frankly, that's a scandal, and that's something else that needs serious attention.
Professor Max Abbott talking to us about the report that was released this afternoon.